You're listening to the Play Therapy Podcast with Dr. Brenna Hicks, your source for centered and focused play therapy coaching.
Hi, I'm Dr. Brenna Hicks, the Kid Counselor. This is the Play Therapy Podcast where you get a masterclass in child-centered play therapy and practical support and application for your work with children and their families. In today's episode, I am answering a question from Judith in Michigan, and she is wondering about a child who came in and did not play. So we're going to talk through that, but a couple of housekeeping things before we get into that topic. First and foremost, do me a favor, please. If you are planning to come to the meetup in Atlanta on October 18th, Friday evening, during the APT conference, I need you to go to playtherapypodcast.com/meetup and let me know that you're coming. So you don't have to pay for anything. You don't have to sign up for anything. I just need you to click that you are planning on attending because I'm trying to secure a specific spot for us to meet. And every single person that I'm talking to about this says, well, how many people are you planning on having? And I keep saying, I have no idea. So please do me a favor, playtherapypodcast.com/meetup. And please let me know that you are coming so that I can make sure that I have enough space and that I can accommodate the number of you all that are coming. So for your reference, if you are not a podcast listener and or if you are not a coaching participant and or if you are not an email newsletter reader, those are the only three ways that I'm going to be publicizing this event. So if you are listening to the podcast, if you are in a coaching program, I suppose in the collective as well. Sorry, I should say that. So collective, email newsletter, podcast, and coaching programs, it's only going to be reserved for those people because there's no other way that I can communicate to anyone else about this event. So please go to playtherapypodcast.com/meetup and let me know that you're coming. That would be really helpful. Okay, second thing, I want to read an email that I got because I got permission to share, by the way. And this was such an encouraging email to me. I think it will be an encouragement to you all as well. So this is from Tess in Illinois. And I just wanted to read this because some of the things that she said, I think just sum up what so many of us have felt. And one of my main goals in all of this stuff that I do is to help us all feel like we're not alone, and that we are doing what we're meant to do, and there's purpose behind it, and there are other people on this journey with us. And I feel that this email kind of represents all of those things. So Tess in Illinois, thank you so much for letting me share this, and thanks for sending this email. So let me share with you what she said. I wanted to reach out to you for a few months now as my practice has entirely changed thanks to the work that you are doing. I've always known that I wanted to work with kids in a pediatric setting, especially the littles. However, once I was in the field, I became flooded and overwhelmed with the various interventions, theories, and perspectives. My first year out of grad school, I joined a pediatric practice in Chicago. This was a wonderful experience for me, as the practice was centered on the population I was passionate about. However, it was heavily theraplay focused and lacked a playroom. That whole year, I felt like I was throwing spaghetti on the wall, trying various directive interventions. I did it all. And I had some great success with clients, but I slowly started to realize that it was due to the relationships I had with the kids and not the interventions. Aha. I spent that whole year riddled with anxiety about what intervention to pick and how I could best support these kids and families. Flash forward to this summer, my fiance and I were forced to make a move due to him starting med school. I joined a new practice as well as a nonprofit focused on serving children and families. This was my chance to redefine myself and find my footing in this play therapy world. I discovered your podcast after a clinician at my Chicago practice told me about it. This makes me laugh. I was so skeptical about being non-directive as a person who struggles with not feeling in control. I talk about that a lot. However, once I listened and opened my mind to it, I was forever changed. I now have my own fully equipped playroom, and I'm currently engaging in a CCPT training. I listen to your podcast, and I recommend it to everyone I can. I feel so much more confident in my clinical skills and it has been remarkable to see the impact that CCPT has had on my clients. Tess, thank you. And I every time I do episodes, I don't know if I've ever talked about this before, but you're going to get a little insight into my world here. I sit and stare at my microphone, but I actually envision all of you. So I think about you all on your walks and on the treadmill and folding laundry and in your car and cooking dinner and all the things you tell me that we do together. And I actually think about you all. And so as I was reading that, I was envisioning you all nodding your head, just in echoing, like, yes, I know exactly what that feels like. Yes, I've been there. Yes, I've gone through that experience. And it is amazing how CCPT grounds us, and it serves as the foundation so we're no longer throwing spaghetti at the wall. And Tess, I think what you said that stood out to me the most, I spent that whole year riddled with anxiety about what intervention to pick and how I could best support these kids and families. We don't have the pressure and the burden of, quote, figuring things out for our clients, because they will do the work that they need to do from the child-centered perspective. And I also was so humored about the fact that I was skeptical about being non-directive as a person who struggles with not feeling in control. I opened my talk at the Florida Association for Play Therapy conference a couple years ago with, if you are a control freak, this might not be the model for you. So I completely understand that as well. But what a special email. Thank you so much, Tess. And I hope that you all just totally get what it feels like to have the freedom of finding CCPT and being all in and what that brings. So really grateful to you, Tess. Thanks for sharing that. Okay, so now we're going to get into Judith's question. That was a 6 or so minute detour, but we're back on track now. Okay, so let me read parts of Judith's email and then we'll dive into this question. Recently, I had a 7-year-old female client come to my well-equipped playroom. I gave her the option to play with whatever she likes. She started playing with a few things, but after a few minutes said she wanted to go home, even though I was engaged with her in play. My other clients always get engaged in some activity and always want to stay longer. She loves arts and crafts, so I make sure every session I have a craft project for her to do that is tied into some type of intervention that I'm doing. I let her lead the details of it, even if I had something else in mind. Do you ever find some clients need more structure and are not just happy to do free play? How do you handle such a situation? I do a mixture of both, starting off with directive play therapy and then letting them have free play, but wouldn't mind going completely into child-centered play therapy. All right. So Judith, thank you for the email, first and foremost. And all right, my veteran listeners that have been with me from the beginning and/or who have binge listened to my podcast episodes in order, you know what I'm going to say here, so this will be no shock to those of you that have been around the block with me. For those of you who are new or have maybe not listened to all of the episodes in order, first of all, welcome. So glad you're here. Second of all, please do that. Please, you don't have to stop this episode, but please stop listening to current episodes and go back and start at episode 1. It is a seminal training. It is intentionally curriculum driven to give you from the very beginning all the way through a complete understanding of the child-centered model. So if you happen to hear about this and you started listening at current episodes, it would do you so much service and justice to go back and start at the beginning. So for those of you that have been around everywhere with me on this journey, you know that I'm going to say, Judith, you have to pick one or the other, and you have to stay in that lane once you decide. So what I mean by that is you cannot be directive at the start and then child-centered toward the end. You can't combine those theoretical models. You cannot have both in the playroom with a child. It is so confusing, and one actually contradicts and undermines the work of the other. So a child that is in a directive play therapy room and under a directive theoretical approach, their brain is going to process things a certain way. A child in a CCPT playroom and under a CCPT approach, their brain is going to process things completely differently. And to have their brains that are not actively wanting to be engaged in therapy anyway, unless they're older than 13, try to make sense of sometimes I'm in charge, sometimes I'm not, sometimes I'm told what to do, sometimes I'm not, sometimes we're, quote, working on something, sometimes I get to do what I choose. That it's just a muddy mess, and it actually serves as a deterrent to progress for either approach. So my favorite phrase, you all know what I'm going to say. I'm sure you're screaming it at your speakers right now. Eclecticism is the death of our field and the death of our profession. So, Judith, I lovingly beseech you. I don't even know where that word came from, but it just came out of my mouth. I lovingly beg and beseech you to decide if you're going to be wholly child-centered, which ideally I hope so, of course, or if you're going to be wholly directive and go forward with that theoretical model, but there can't be an intertwining of the two. So that had to be said straight out of the gate, just because the rest of this kind of falls apart if we're not really sure that we're doing one theoretical model with kids. Okay, so now let's answer some of the other details of your question. When you specifically said, do you ever find some clients need more structure and are not just happy to do free play? Yes and no. So my answer there, that's not a non-answer, it's a both and. There are some clients that want more structure. They crave more structure. They can't fathom not having structure. And then there are kids that are very uncomfortable being in charge, and they're very uncomfortable with the child-centered approach where they're given autonomy to do whatever they choose to do. But do they ever need structure and are not happy to do play? No. Because the children that are not comfortable playing and that crave more structure, that's maladaptive coping. So if we have a child that comes in and says, I don't know what to do, can you just tell me? Can you just ask me questions? Or they sit and do nothing. We know there's an undercurrent issue going on, likely huge levels of anxiety. Almost always through the roof anxiety levels. And how will a child ever learn to work on those issues if they're not forced to confront scenarios like that? They want structure. They want to be told what to do because they have no practice making decisions. They have no practice taking responsibility for their choices. They have no practice owning what happens instead of just listening to someone else. This is a process where kids are learning to do things that they never get the chance to do anywhere else and with anyone else. So they have a therapeutic guide rail in us as a CCPT therapist, and then they're able to do this work, which is deep and scary. It's overwhelming for highly anxious kids. So of course she's going to sit and not play. Of course she's going to say she wants to go home. Now, Judith, you didn't happen to say what session this is, but I suspect maybe in context it might have been the first session. So if that's the scenario, then there's another factor here. There's no relationship built yet. You're a stranger to this little girl on session 1. And it's very scary to go into a strange place with a strange person and have strange expectations. So many kids will avoid that. Many kids are unnerved by that. And that is a patience process for us. We need to be patient. We need to trust the process. And we need to just continue to acknowledge what's going on. So our responses are going to be, we reflect content and we reflect feelings. Oh, you really wish that our time was already up. You're nervous about not having something specifically to do. You're uncomfortable that I don't have anything that we're going to work on today. Okay, so we're going to constantly use reflective responses in those moments, but then we're going to set pseudo limits as well. You really wish that our time was already up, but we still have 20 more minutes left. Because the goal is that the child learns to sit in the pocket of their feelings, and the child learns to sort through the discomfort and the unknown and the fear, and they build coping skills and resilience and problem solving and all kinds of other things along the way. So we absolutely are going to be patient and just honor the fact that the child isn't ready to play yet, but every child eventually plays. And I can say that as an absolute. In almost 20 years, I have never had a child that refuses to play forever. But I've had, oh my gosh, I don't even know, probably 100 kids that have refused to play at some point. So we have to trust that when a child is ready, willing, and able to play, they will. But until that point, we continue to be engaged verbally. We continue to return responsibility. We continue to reflectively respond. And we give them the freedom to work through it. And eventually, kids will know the work they need to do. They always know the work they need to do. But eventually, they will get to the point where they can do that work. And then my final thought is, you mentioned that you know that she loves arts and crafts, so you make sure every session that you have a craft project for her to do that is tied to some type of intervention that I'm doing. Okay, so again, as I mentioned before, we can't have directive and non-directive in the same playroom. So absolutely have arts and crafts materials there, but you leave the prompt open-ended. You can play with all the toys in most of the ways that you'd like. And she will probably gravitate toward arts and crafts if she loves it, because that's safe. It is not going to unearth things that she's not ready to deal with. She can sit and color or paint, and that is soothing and calming and avoidant. Many anxious kids, many kids that can't handle the control of being in charge in a playroom, will start with artistic play, because it's something that they can control and manage, and it doesn't feel as scary. So Judith, I suspect she will naturally move toward arts and crafts at some point without it being, quote, tied into some type of intervention that you're doing. There can't be an intervention other than adherence to CCPT. So you can play with all the toys in most of the ways that you'd like. You're in charge when you're here, and then she has it from there. So I hope that that's helpful to all of you. I hope that for some of you that maybe have been straddling the fence of, so hold on, take a left turn with me for a second. When I was younger, I don't even know at what age this happened, but I went to like a youth convention or something with my church. And the word that the guy that was speaking used for someone who had one foot on each side of the fence, you know, like the fence straddlers or whatever, he called them mugwumps. So when I said, you know, if you've been straddling the fence, I was like, you mugwumps. Anyway, this is the way my brain works, y'all. So if you've been a mugwump and you've been half in, half out, and you've been doing some directive and some non-directive, first of all, I'm so glad you're here, because you stick with me and this group long enough, you will be a full CCPT convert by the time this is all said and done. So you're in the right place, but please be mindful that you can't do both. It would actually be more harmful than good for a child to be trying to make sense of a directive and a non-directive approach. They can't coexist. So please be mindful of that, and please be encouraged that this podcast equips you with everything you need to know to be all in on CCPT from episode 1 all the way through in order. So I hope that that encourages you, hope that that supports you. And as always, the collective is available to you, ccptcollective.com. We have 130 members in there now. So if you would like to be around other CCPTs and have support there, please check that out. The coaching programs are available. The email newsletter encourages you and supports you. There's all kinds of ways so that you can feel like you know what you're doing, you can be confident, and you can be articulate about this process. All right, y'all. Love you. Have a lovely week. I hope that you've been enjoying the more consistent Q&A. So I'm really trying to get through these emails, and I appreciate you listening to all these episodes each week. I think it's been like 4 a week, so I know that's a lot, but I appreciate y'all. Talk again soon. Bye.
Thank you for listening to the Play Therapy Podcast with Dr. Brenna Hicks. For more episodes and resources, please go to www.playtherapypodcast.com.